In India, millions of children and mothers suffer from malnutrition. But why does this crisis still exist despite so many programs? Hi, I'm Anya, and this is Beyond the Plate, where we look beyond the obvious. In today's episode, we explore the hidden causes of malnutrition, its long-term impacts, and why solving it is more complicated than it seems. Let's start by understanding the scale of the issue. Nearly half of all child's deaths in India are linked to undernutrition, but this isn't just about food. When we hear the word malnutrition, we often imagine a lack of food, but in reality, it includes undernutrition, stunting, and wasting, and it disproportionately affects mothers and young children. So, this raises a key question. Why does malnutrition in India persist despite existing interventions, and what actually determines whether solutions work? My argument is this: malnutrition continues not simply because of food shortages, but because of interconnected systemic issues like poverty, sanitation, education gaps, and uneven implementation of policies. To understand this better, let's look at what's really causing the problem. Let's start with a common assumption. If people are malnourished, it must mean they don't have enough food. But that's only part of the story. According to the World Bank, malnutrition is closely linked not just to poverty, but also to poor sanitation. Even when food is available, unsafe water and unhygienic conditions can lead to repeated infections, preventing the body from absorbing nutrients properly. UNICEF also reports high levels of undernutrition, especially among children with poor maternal health. So already, we're seeing that malnutrition is not caused by a single factor, but a system of overlapping issues. To understand why malnutrition persists despite existing programs, I spoke with a public health expert. Hello everyone, today I'm here with Dr. Rupali Chopra. She is a Chief Medical Officer working with the government of Delhi, India. She has over 20 years of experience working in the public health sector. Thank you so much, Doctor, for being here with me today. So my first question is, how do you think poverty plays a role in malnutrition?
See, poverty is in a way directly related to malnutrition. First of all, it affects the purchasing power of the family. And secondly, poverty leads to malnutrition. Then if there is malnutrition, that leads to a lower immunity amongst the people. Lower immunity leads to diseases. Plus, if they have a disease, they have to spend more, which leaves them with lesser money, again going into poverty. So it's a vicious cycle, I would say. Poverty leads to malnutrition, and malnutrition in turn leads to poverty.
Thank you so much, Dr. Chopra, for your valuable information on what still needs to be improved on.
Thank you. Thank you.
What stands out here is that even with strong government programs, deeper systemic issues still drive malnutrition. Malnutrition is not just about access to food, it is about whether the body can actually use that food and the conditions people are living in. And as the doctor explains, it is also deeply tied to poverty and awareness. This creates a cycle. Poor living condition leads to illness, illness reduces nutrient absorption, malnutrition weakens the body, and poverty makes recovery even harder. This is why solutions that focus only on food often fall short. So, what does this actually lead to? Malnutrition doesn't just affect people in the moment, it shapes long-term outcomes. The Global Nutrition Report shows that anemia rates among women in India remain extremely high. This weakens maternal health and increases risk during pregnancy. According to UNICEF, malnutrition is also linked to a significant portion of child mortality. But even beyond survival, the effects continue. Reduced cognitive development, lower academic performance, and long-term economic limitations. So, malnutrition isn't just a health issue, it is a barrier to opportunity. So if we understand the causes and the consequences, why does the problem still exist? India has introduced initiatives like Poshan to improve nutrition among mothers and children. These programs focuses on awareness, healthcare access, and nutritional support. But according to the Lancet, malnutrition persists because of deeper systemic issues. In other words, policies alone are not enough. Implementation varies. Resources don't always reach the most vulnerable populations, and social inequality continues to create barriers. So even strong solutions on paper don't always translate into real impact. And that brings us back to the bigger picture. Malnutrition in India is not just about food. It is a complex systemic issue shaped by poverty, sanitation, education, and healthcare access. It affects not only individuals but entire generations. And as we have seen, even with expert insight and national programs, the real change lies in addressing deeper systems behind the problem. So here's the question I want to leave you with. What would change if we stopped treating malnutrition as just a food issue and started treating it as a systemic one? Because until we do that, we're not solving the problem, we're only addressing the surface. This has been Beyond the Plate. I'm Anya. Thanks for watching.